The Department of Insurance should have plenty of power to regulate this law.
And he should know he wrote that law. So far, the Pritzker administration has done very little to enforce it.
At least not before we started asking questions. It wasn't until after we filed a flurry of FOIA requests the State Department of Insurance suddenly said it was looking into the changes Blue Cross made to its network.
The problem we were trying to address was not having standards in the state to be sure that there was adequate coverage and access for people who needed health care, particularly in specialties, that there were plans so that if insurance plans changed, people who had severe conditions or were undergoing treatments did not get disrupted. We wanted to be sure there was continuity of care, and we wanted to be sure that we were holding the insurance companies accountable for providing accurate, up-to-date information about who is in and out of network so that people can make the right choices of doctors and hospitals.
That state law requires insurance companies to provide an adequate network to its customers. And just like you wouldn't want your car dealer to strip your new car down for parts right after you bought it, the law says insurance companies can't dramatically reduce the network that they sell you. If they do, they have to report what's called a material change to the state within 15 days. Now, Blue Cross initially told us they didn't believe that kicking all these doctors out of Springfield Clinic constituted a material change. They've repeated that again. And after we started asking questions, the State Department of Insurance agreed with us that it was a material change and ordered the company to refile its network for review.
Well, a few medical emergencies are more urgent than cancer, but when we called through the Blue Cross directory, we only found 2 radiation oncologists who are actually taking patients. That's in Decatur. There are none in Springfield.
That's it for more than 60 miles in that radius, even though the Blue Cross website claims it has 10 doctors available.
We have much more of this investigative report up on our website right now, including a closer look at documents that show Blue Cross is driving medical bills higher for patients.
We showed you how this is affecting patients and their bottom line, but how is it impacting doctors and their practice?
They prefer no one to leave, but we're starting to hear that a little bit, unfortunately.
That's next.